Approximately 1 in 6 U.S. Medicare patients who are discharged from a hospital will be readmitted to the hospital within 30 days. Imagine if we could just change that number to 1 in 7. This is why Clearday built our platform to support our affiliated operators and partners. We, alongside our independent nonprofit partner Trex, looked at some of the most common reasons for hospital readmission: medication noncompliance, fall injuries, and failure to identify and address post-discharge needs. We said, let's not just imagine, let's create. Using innovative technology and the power to provide people better patient outcomes and to prevent hospital readmissions. This helps everyone win: operators, families, payers, and most importantly, patients. We are operators and know the hardships, the anxiety, and the costs of the industry today. So let's talk about Mrs. Smith, a real resident whose name has been changed. She moved into one of our affiliated communities. We administered our trademarked, purpose-built BEST test as an alternate to the traditional assessment used for decades by the industry. Mrs. Smith had many risk factors upon move-in: high fall risk, averaging 4 falls per week prior to move-in; anxiety due to those falls and a new and unfamiliar environment; difficulty sleeping leading to a lack of adequate sleep; a history of UTIs. Our platform is built for the front of the house to support people like Mrs. Smith, her caregivers, and her family. The BEST test produced a personalized digital care map built around mind, body, and soul. During the 16 months Mrs. Smith was in our affiliated community, she fell once. That's right, I said once, as compared to the 4 falls per week she experienced at her home. By preventing falls, we kept her out of the hospital for 10 months. Now, she did eventually require hospitalization, but this was for a UTI, not a fall. Once this was resolved, she returned to the community and lived happily for another 7 months. How did we accomplish this? First, to address falls, the affiliate used the platform's movement analytics to analyze Mrs. Smith's range of motion. This information was integrated into her digital care map, along with a personalized home exercise program created by a physical therapist. The affiliate was then able to deliver this personalized, regimented program via robotics and smart TV to maximize compliance with the program to maintain or improve function and safety. As her falls decreased, her anxiety and fear of falling decreased, and her sleep habits improved. A win-win for all stakeholders.